identified, as Dr. Iwan mentioned, the alpha variant, the B.1.1.7, that is still the predominant strain. More than 1,500 cases that we've managed to identify, though we're seeing slower increases in this alpha variant than we are seeing in the Delta or Gamma variants. So.
Thank you, John. That was exactly what I was digging through my emails for. I will note that we are noting a increase in the Gamma variant, but it is what is being seen across the nation. It's not specific to Nebraska only. We are mirroring what is occurring across the nation.
I believe it's the common variant now seen on the East Coast. Is that correct?
Yes.
Yeah. Yeah.
All right.
This Delta variant in New Jersey in particular is the predominant variant.
Yes.
All right. And thank you, John, for sharing the link to that weekly update. If you do click on that, I do believe somewhere there's a way that you can subscribe to this. I will try to find that eventually. Don't want to make people too dizzy here. But I will share that information as well. So thank you.
Question, has anybody did any matching of the variants to vaccination in terms of fully vaccinated individuals and variants?
Are you asking from the standpoint of vaccine breakthrough?
Yeah, I'm thinking in terms of people who are fully vaccinated, how many are turning up now with any of the variants?
So
I mean, we've seen a few.
We are testing for those. The tricky thing with the vaccine breakthrough is you generally don't have a way to ensure that the individual receiving the vaccine actually generated an appropriate antibody response. So it's hard to link that it is a variant causing the vaccine breakthrough as opposed to just an infection due to an individual that did not mount an appropriate vaccine response. So we are assisting the state in these testing. They are forwarding specimens of interest to us, and we are performing the sequencing on those specimens. And then that is the information of our sequencing and is then paired with the information that Epi team's getting to determine if it is a true vaccine breakthrough. What I will say is that of these different variants of concern that we're watching, there is not like one that is for sure causing vaccine breakthrough, if that's what you're asking, Tim.
Yeah, I just got to try to get a sense, but we've had a few that have been vaccine breakthroughs.
We are also, this is Pete, we're also looking at the immune response through some serological testing on these folks and are looking for patterns of where they may not have responded well to the vaccine, whether it's the Moderna or the Pfizer vaccine, for instance. So we are compiling some data from that side as well. And we also know some of the elderly people, of course, are immunocompromised in some way and they do not respond very well.
Yeah.
And from a personal note, I can share that it isn't just the elderly. At least I don't consider myself elderly yet.
You're not, Karen.
But I would think that immunosuppression and some of the meds that are out there nowadays certainly can cause problems with that vaccine. So it's interesting information that we'd like to hear more about, and also really points to why people maybe feel masks are still important. So, all right. Thank you, John. Thank you, John, on that. I greatly appreciate that. Brianna, is there anything else that you'd like to share with us? It doesn't have to be, a big update, but just anything new.
Sure, I'll just touch on a couple things. One, that we're still seeing norovirus even in the summer. We've had a couple outbreaks in the southeast part of Nebraska and even the western part in the month of June. Also, being that we're going into the cyclospora season, just wanted to remind labs to, if you have any cyclospora positive specimens, to submit those to the public health lab. Though I don't know if Emily, you want to chat about the genotyping, but basically we want to get those specimens to the public health lab so we can do genotyping to determine linkage among cases, and also other states across the United States do the genotyping as well. So this also helps with multi-state outbreaks, which we typically see on an annual basis in the summer.
That's for both cyclo and crypto.
Right. Yeah.
Just wanted to throw that in there, cryptosporidium as well as cyclospora.
Yes. Please send your cryptos as well. But we haven't had any cyclospora cases reported so far in 2021, which is shocking. Typically, we would start seeing cases roll in May and June. Last year, we had was our biggest year of cyclospora. We had 88 cases. In previous years, it was 36, 22, 9, and 10. So we'll see what this year brings us.
Hey, Brianna, it looks like we've had one case of cyclospora sent to us.
Yes, that was an Iowa resident. So
It was, okay,
yep.
good to know.
Yes. When I saw that reported, my heart sank, and
Yeah,
then
I thought, are we
Iowa.
starting? Yeah, are we starting out? Okay, that's awful.
Yeah, so I sent it over to Iowa. I was like, sorry, here you go. But they said they've seen a couple cases so far. So their caseload's always more than ours, and they always see cases reported before us. So I don't know. We'll see. I hope it's nothing crazy this year.
Yeah, okay, thanks.
Yes, thank you, Brianna. I know it's early in the year, so keep your fingers crossed. It's not necessarily a respiratory disease, so why would it be? And the fact that we have not seen it, who knows? But if you as a laboratorian do see it, please let us know as quickly as possible. And also just make sure that you can send us that specimen as long as it's in the transport media that's required. So, all right, I'd like to move on. Pete and Emily, there's a couple of things on the agenda that if you'd like to speak on today. I know we've already talked a little bit about some of these. Emily, did you want to say, or Pete, more about crypto EIA testing at this point?
Not at this point. I could just share the fact that we are still looking at EIA tests that are positive for crypto, trying to run some confirmation testing. And we have seen a fair number of those results coming across as negative for crypto, and a couple of them actually came across as positive for cycle. So we're just trying to evaluate the EIA test in more detail, and we will talk to the labs that use EIA tests in the future just to let them know what kind of results we're seeing. Something else I just wanted to mention about the respiratory season that just seems to keep on going on, I guess, that the public health lab continues to run a multiplexed assay for COVID and influenza. So we are really doing a very big broad sweep for influenza this summer as well, just in case it is a delayed season. So we are still looking for it. We have not seen any that I know of. So we are in our respiratory season probably throughout the whole summer, and we're going to get ready for the fall as soon as it gets to that point. The other thing is that, you know, of course, the GI season mentioned by Brianna and Emily is ongoing and taking off now, and the West Nile virus are keeping us busy as well. I'm trying to think of other things. Noros, Emily, we're still seeing some Noros, is that correct?
That is correct.
Anything else, Emily, you want to mention? I know we've been really busy the last couple of weeks, but it just seems like everything's coming at one time again.
We're just having such an odd year with everything going on, as these guys have all spoken to. We don't have a clearly defined respiratory season. We don't have a clearly defined enteric season really this year. As they said, norovirus is spilling over into the months that we don't commonly see it. Nobody knows what's going on with common respiratory illnesses like influenza. So we're just really kind of maintaining our surveillance all the way through the year instead of focusing to more of a seasonalized approach. And it's keeping us very busy here because there's been lots of interesting things popping up.
It's also weird. We're seeing increase in activity in RSV, which is out of season for this time of the year, but we're seeing it locally here.
We're seeing it locally, and I believe the CDC released information as well that it's very rampant down in the South. So no kissing babies right now.
Right. And the other respiratory viruses too are fairly common, like the rhinoviruses, the other coronaviruses are fairly common right now too in our testing. So
Wow.
it is a delayed respiratory season, and I guess the big concern is that will influenza start showing up this summer like it did a few years back?
Yeah.
So if anybody gets positive antigen tests, for instance, for influenza, we'd be happy to confirm those.
If Robin were on, she definitely would recommend that too, Pete. So good to know. Any questions about COVID or crypto so far? I don't see anything on the chat box.
This is Gerald from Syracuse. One thing I was just thinking about with all of the stools is just hard for us to handle. Epidemiology, you guys benefit from the multiplex, but we're always fighting insurance. And so some of that is just how insurances, I mean, they hate the biofire panel. So doctors catch on to that too. So that can be to where we just decrease. If you're not going to pick up the cyclospora on the typical stools, you probably pick up a lot of those on your multiplex panels. And so that's probably where you're seeing a decrease of those two, probably. I don't know.
Right.
I know we're always trying to juggle that to try to have those ordered, but they like us to save them for the real sick.
Yeah, we realize the cost of the GI panel is quite expensive.
Right.
For the panel itself, but we're going to continue doing some confirmation testing, and we will just see what kind of results we have and see if it's cost effective for us to actually do confirmation testing on those EIA positive samples that come in. So we'll let people know how it works.
Yeah, thank you, Gerald, for that information. For those laboratories that may not necessarily keep the transport media for stools on hand, that is something that you can order from us just by talking to our client services. So keep that in mind if you test only maybe your hospital patients and are able to get them within that 2-hour span. And if it's positive, then you have time to still put it into a transport media to ship to the Nebraska Public Health Lab. So, all right. I was going to move on to client services. I just wanted to see if there were any shipping issues or other that you wanted to share. I know Brian Lenz is on from client services. If you have any information to forward, please let us know. Or has anybody had any shipping issues that you would like to share with us? Please let us know. All right. One thing that we have noticed here at APHL is just some problems with the actual address, depending upon what it is. If it's a category B, it has one address. If it's a category A, it has another address. And that's simply because it's different places that it is delivered to. Category A's are delivered directly to the client services area. So make sure that on our requisition that you see, you can look that up and make sure those addresses are correct if you're not using our boxes. So Emily, do you want to take a moment and just talk real quickly about the 24/7 pager?
Sure. As everyone on this phone call knows, NPHL has a 24/7 pager that is obviously staffed 24/7. That pager is set up to be used in emergency situations such as a real or perceived bioterrorism event, chemical terrorism event. If any of you microbiologists are working up an organism and you hit those trigger points that say, hey, I need to work this up in a hood, it is a potential bioterrorism agent. That is the use of the 24/7 pager, and we love that we have the ability to communicate with you guys all the time through that pager. What I did want to note is that pager can be used for other things. We're happy to answer any questions you guys have on that. So if you are ever in dire need of information, please feel free to reach out. We don't ever want to discourage anyone from using our 24/7 pager, but that pager is not the way to report via ELR or manual methods if a reportable organism is identified. That is something that is set up with the state. And when I say the state, that actually goes to Nebraska Department of Health and Human Services. It does not go to Nebraska Public Health Labs. So that communication of identification of reportable diseases, such as outlined in Title 173, which you guys should all be familiar with and have the lovely little flow chart hanging up in your lab, that needs to go to the state, not to Nebraska Public Health Lab. And the pager, even if you page us with that, we're going to tell you you have to get that information to the state. So like I said, while I don't want to ever discourage anyone from utilizing the 24/7 pager, please do if you have questions or anything. Just know that it is not to be used for the identification of reportables, because that needs to go to the state so that they can start their case investigation.
Emily, thank you. Yes, I know that if you have our chart of all the reportable diseases, it has the phone numbers right on top. So you'll be able to find the correct phone numbers there. If you do not have that list, put it again in the chat box, email me. I would be happy to share that information with you. Next, I'll move on to communications drill. I did not get that done last month. It's been crazy here for NPHL because we are waiting for our CAP survey to surveyors to come. And we're diligently working on being prepared for that. So some things have slacked, I admit. So that communication drill has to go out probably here in the next week. So please, please, please be watching for that. It is going to ask you just a couple of questions. I promise it'll be a quick survey. I do need everybody to answer it as much or as soon as possible, and have someone from your facility answer it. If not, I may be calling you just to get that information. So that would help me out greatly if you can finish our communication drill. It is a requirement of ours from CDC to complete this drill on a quarterly basis. So we appreciate your compliance. One other thing I can share before I open up the mic is I have a blooper, not from any of our Nebraska laboratories, but from out state. But I want you to all take a look and see what you think about this. Tell me what mistake is on this particular package. I think you will all recognize it as a category A. Might be a tough one. If I were to compare that to this one, I think you'll now see the difference in the blooper. So this is also a category A. The color is not the difference. It actually is the fact that I use white boxes for my category A, honestly, is just a formality. So Looking again closer here on the corner is the little triangular box that does explain what this is, that you do have the UN 2814 infectious substance affecting humans. So if you're going to use this label, you do need to use this. In addition, you need to have the amount of that your payload right here written on the box, as well as your shipper's declaration, which is something that needs to go with it too. So for all you microbiologists, wanted you to make sure that you could recognize that difference. So I also have a few minor items on as far as training. You will notice on page 2, I've got quite a few CDC trainings that you can do. They all are online. I would highly recommend any of them in regards to fundamentals of PPE, possibly even working in a biosafety cabinet. I would highly recommend if you are looking for things to use for competency testing for your staff, that is something you can use. How to use the biosafety cabinet. Have them watch this particular video. It's only maybe 3-4 minutes tops. Won't take long, and it's got a lot of valuable information on it. In regards to our BT rule out and refer, it's still on the dock for sometime this summer. As soon as I can get some of our CAP stuff done, I hope to start working on that and get it on the calendar as soon as possible. So with that, then the challenge set will follow. And by then it will be fall. So any questions on any topic, please open your mic and let us know. We'll give it a minute or two here to see if there's any questions. And you're welcome to put it in the chat as well. All right. Everything going good? Anybody else getting their inspection done this summer? All right. Well, hearing none, we'll go ahead and call it a day, give you 20 minutes back. So thank you all. And we will be talking again next month, the 3rd, oops, and I forgot to put the date in July, but I will definitely send out the invites for you. 3rd Monday of each month. We'll see you in July. Thank you all.
Thanks, Karen.
You bet.